Welcome. My name is Dr. Collie Shaw. I'm a third-year internal medicine resident here at Unity Health in Searcy, Arkansas. I am speaking on behalf of my esteemed colleagues, Drs. Alhuda, Carpenter, Durrani, Guastella, Altoff, and Martin. I'm here to present to you a very interesting case report of a patient we saw in the emergency room and in the ICU a few months ago. The title of our report is Unilateral Mydriasis Following Precedex Administration in an Elderly Patient. But to give you more context, this was an 83-year-old woman that presented with worsening confusion and respiratory distress from home after being found by her daughter completely altered and having severe issues with speaking without respiratory distress. She had been previously admitted to our hospital system a few weeks prior to this with a COVID infection and superimposed bacterial pneumonia. And she had had a known long-standing history with congestive heart failure, previous strokes with residual deficits in her gait, as well as atrial fibrillation, which was persistent, and she was on chronic anticoagulation with Eliquis. Of note also, 3 years prior to this, during the COVID pandemic, she had had a severe COVID infection and had been on the ventilator for multiple weeks. So upon introduction to internal medicine while in the ED, we found the patient to be completely altered, ANO times 0, ANO times 1, with severe respiratory distress, being unable to speak in complete sentences, found her desaturating into the mid-70s, even on 6 liters of nasal cannula. And after discussion with the emergency department and with her initial ABG, we found that it would be best suited to place her on BiPAP ventilation and send her to the unit for closer monitoring. As she started to get slightly better with the BiPAP ventilation, we found her to become more and more anxious with it. She was very scared because of her previous interaction during COVID with being intubated, and she was unsure of whether or not she wanted to actually be intubated if it came to it. And initially, in the first few hours of her admission, her ABGs were not improving even with BiPAP ventilation, and the decision was coming close that if she lost her compensation that we might have to intubate her. And after discussion with her daughter, it was decided that in order to ward off intubating this patient, we were going to start Precedex in order to calm her anxiety on the BiPAP ventilation. However, unfortunately, she started to display a severe phenomenon with after just a few minutes after starting the Precedex drip, she became completely altered again, coming back down from an ANO times 3 back down to ANO times 0, completely altered, completely delirious. And also she displayed a physical exam finding that was very curious to us, Anisocoria. Her left eye became dilated and was unreactive to any stimulus. And the concern from the ICU team was that she was having another acute stroke. So a stroke workup was urgently ordered. She got a CT, an MRI, an MRA, and we found that she did not have any significant immediate injury, but had also had the same kind of chronic infarcts that she had already been known to have. As you can see in the imaging in figure 2, no acute focal findings, just chronic findings. However, we quickly took to the web. We were trying to figure out what was going on with this patient, and we did take into account the association with time with recently starting Precedex, and we found that Precedex had already been known to maybe cause this kind of reaction in nasal surgeries and in younger kids, and so we decided to stop the Precedex. And immediately, within a minute or two, the patient became more oriented, her Anisocoria completely resolved, and we found that even though we had seen this before in only a few case studies, that this maybe needs to be something that's widely talked about Precedex. It has alpha receptor agonism, which can particularly be compromised in previous strokes and can make it even more susceptible, even in small doses, that lead to the side effects that it's known for, which it can include mydriasis, as well as it is intended inhibitory effect that you use for anxiety. And I appreciate your time here. I know I'm limited a little bit on time, but if you have any questions or concerns, please reach out, and I would love to answer any and all questions, concerns. Thank you for your time.